introduce a little bit about why we've all come together today. The National Women's Law Center actually called for an early learning day of action. So organizations all across the country are holding events to help people understand the importance of early childhood education. We're trying to let people know that when you drop your child off at an early education center, it is not just babysitting, but they are learning and they are developing and they are preparing and getting ready to enter kindergarten with the appropriate skills in order to succeed later in life. So hundreds of thousands of children all across the country actually enter kindergarten behind their peers. And this makes it very difficult for them to catch up and to be able to excel in their education and then in their endeavors later in life. So children with access to quality early care and education are more likely to do better in school, they're more likely to find better jobs, they're less likely to commit crimes, and they're less likely to rely on public assistance later in life. Just here in Nevada, we have over 224,000 children that are between the ages of 0 to 5. And we have only about 45,000 child care slots, which only fulfills 33% of the needs. So it's about 70% of the kids who don't have access to early childhood education. And then we do have subsidy and assistance programs. However, they're only meeting 1.9%. So that's almost 2% of the need that we have here in Nevada for our low-income families who really do need that assistance. So we know that more than 80% of growth for children and brain development happens in the first 5 years of life. So we know that starting early is starting right on time, and we need to make sure that every one of us make that a priority here in Nevada and across the country. So that's what we're here to talk about today. And it's my pleasure to introduce Denise Ashby, who's the Executive Director of the Children's Advocacy Alliance, who's going to talk a little bit about our legislative activity and what we're doing here in Nevada to improve quality early care and education. Here, Amanda.
I just want to start out by saying thank you all for coming. I know we've done events in the past, and I think every time we do one, we get a few more people and a little bit more interest. Like to see our group get a little bit more diverse for those who aren't in the early childhood field, but we're working on that as well. So as many of you know, there's been a lot of attention to the early childhood education issue both at the state and the federal level here recently. I think this was the first year in our history where both the State of the Union and our State of the State Address both mentioned early childhood education. So I just, with the end of our legislative session, and we just on Monday, or yesterday I guess, include the special session, I just wanted to go over some of the wins. Actually, this past legislative session has been one of the biggest for early childhood education, I think, in our state's history. Early childhood education received a lot of attention. One of the services that our organization does in collaboration with the Nevada Institute of Children's Research and Policy is a legislative bill tracking. So we actually had 8 bills this legislative session related to early childhood education. And while I won't go over all of those, I just wanted to highlight a couple of those. The first one is AB 79. And AB 79 actually establishes the Nevada Early Childhood Advisory Council within the state. Some of you are familiar with that council. That previously was just under an executive order, so now we have statutory authority to create that advisory council. It also lays out the responsibilities of that council, so they'll be looking at issues such as defining school readiness for our state so that everyone understands that in law, speaking the same language. It also does things like looking at our longitudinal data system, making sure that we're connecting preschool data with K-12 or even post-secondary. So that's a good one for us to have that established in statute. Another one that we've been working quite heavily on, and I want to thank all of those of you who are here who have been assisting us with this effort, is AB 109. And AB 109 was really directed at some of the quality issues that we have currently in our state that Amanda touched on a little bit. Quality is a huge issue. We have some of the lowest numbers of accredited child care facilities in the country. We also have some of the lowest qualifications for directors and teachers in our early childhood education centers. So this bill is beginning to raise those qualifications for directors of early childhood education centers. It also increases annual training hours for teachers in early childhood education centers. And this bill has been attempted in the past, and it's something that we really came together on as an early childhood community during this session, and received overwhelming support not only out of myself, but also the state entities and both public and private providers from across the state. We also, Senate Bill 486 passed, and that would make an appropriation for data system projects identified by the P316. I guess it's the Pre-K20W Council now. They changed the name of that as well during this session. So essentially that's going to provide funding for school readiness assessments and pilot programs, as well as some funding for the longitudinal data systems that are put in place. So we're seeing some great things this session. We did have a couple losses as well. There was a strong effort to expand full-day kindergarten in our state, and that bill did not pass. But that's something that hopefully that we can get all of you in this room to work with us moving forward in the next session as well. And I also wanted to bring up, there's been a lot of attention at the national level regarding the importance of early childhood education. There was actually a press release issued yesterday by the White House that talks about the President's Preschool for All program, and actually gives some statistics on what that will mean for the state of Nevada. So I just wanted to go over some of those with you all. Essentially, the plan is aimed at providing preschool for all 4-year-olds, making sure that they have access to high-quality preschool. In Nevada, this would mean an estimated $32.1 million in the first year, which would serve about almost 4,000 children from low to moderate income families in the state of Nevada. Would also mean a new $1.4 billion competitive Early Head Start Child Care Partnership program, which Nevada could also apply for, and we've got a lot of folks here from Sunrise. So we're excited about that opportunity. Nevada's also estimated to receive about $6.9 million in the first year for expanded home visiting programs as well. So it's been a great year for early childhood education. We have a lot of work to do, and we hope that you all will join us as well. So with that, I'll take this opportunity to introduce you all to Patty Boyda with the Office of Early Care and Education in the State Commission on Health. Did I say that right? We'll be talking to those long titles. We'll be talking to you a little bit about the state's quality rating system.
Hi, thank you all for coming. It's so nice to see a big turnout. I am going to talk about the Silver State Stars, Quality Rating and Improvement System. So there's a nice long title for you. But it's otherwise known as a QRIS. And so we're really excited. As Denise said, I'm part of the Division of Welfare and Supportive Services Child Care and Development Program. So the funding we receive mostly goes to the subsidy program. Unfortunately, as Amanda said, only 1.9% of our children are being served at this time, but we still want to help the families that need that assistance so they can get child care, go back, work and be productive. And so, but the federal government says when you take those dollars, you set aside 4% of the funding, and states can do more if they choose, but the minimum is 4% to improve quality of child care, specifically focusing on the child care centers that take child care subsidy children. And so, because we want those children from low-income homes to have the best care. So the QRIS is a new initiative, relatively new for Nevada, but it's been around about 10 years. And now, every state across the country either has a QRIS, is piloting, is developing, except for one, which is unusual, but theirs has to go through a legislative process. So it really is the big movement across the states. A QRIS is really a way to look at child care centers and kind of rate them in terms of a star system. It's interesting though that every QRIS across the states is a little bit different because it's based upon above and beyond what you do for licensing standards. So But it is a way to help centers or family home providers look at their business practices, look at how they serve children, look at what's happening in the classroom environment, and it gives them a very systematic way of making improvements, very small steps to help them improve quality of care. So when we talk about our model for Nevada, it is a 5-star system. There are some that are 3, 4, 5, but ours is a 5-star system. We often say when we talk about a QRIS, oh, it's similar to a hotel or a restaurant when you look at those kind of businesses and they say, oh, 5-star restaurant's really good, it's going to be good. A 5-star hotel, it's going to be a nice bed, nice sheets, and nice amenities. But it's a little bit different when you're looking at child care centers in that for us, any level above star level 1, because star level 1 in our system means you're meeting child care licensing regulations, which is a good thing. We want everyone to be licensed, obviously, and that does mean something. But voluntarily, if centers want to, they can start to enter into our program and choose to try to earn 2, 3, or 4, 5 stars. So we look at even a 2-star center is going to be a really good thing because they're going above and beyond what child care licensing is expecting. And the other nice thing about a QRIS is that we don't just go in and rate, we don't just go in and make little check marks. We give them a lot of support and we give them some funds for materials. So a center who chooses to participate in our program will get up to 18 months of coaching. So that means that a center can get someone to come in who's been trained and they can do a quality improvement plan, they can help change the classroom environments, they can help write policies if a center needs new policies. They can help them make those changes, whatever they need. And so that's a lot of support that they're going to be getting. They can also get a grant to buy new materials. So if one of the areas the center's lacking is maybe some books or a play area, then the grant funds can go with that. So it's not that we're just rating centers, we're not just kind of throwing them out there and then saying, oh, look, you only got 2 stars. We really do want to be supportive. And then the other big piece that we're learning from states, some of the states who have been doing their QRIS for over 10 years, what they've learned is if we don't continue to support centers, they kind of backslide. So another big part of a QRIS, in addition to the initial support they get before they're even rated, they can get continual support from our coaches. And so our program is very new. We don't really have centers rated yet. We do have, we piloted our process for 3 years previously and really tried to get, since every QRIS is a little different, we couldn't just copy from Utah's or whatever. So we had to really look at what is Nevada doing well, what can we improve on. So an example of that is Nevada licensing. We're one of the few states that doesn't have group size and ratios written into their licensing regulations. And so in most places, you look at child care licensing and you would say pre-K room, 20 kids, 2 teachers would be the group size and ratios. Well, Nevada doesn't lay it out that way. So in our QRIS, because we wanted to go above and beyond what licensing requires, we do have those in our QRIS. So that's a great example of how we kind of go above and beyond licensing. So we're excited about this. We have about 22 centers. We started the program officially last July in Southern Nevada only. We have 22 centers getting coaching, and since they can get up to 18 months of coaching, we haven't really started rating yet. And then our project will go statewide starting July, in just another month, but we already have 20 centers signed up for the coaching program there. And actually, because coaching is so intensive and it takes, they can only have a small caseload, we're actually looking at a waiting list already. It's incredible. I mean, we're excited, we talk about is this program voluntary or mandatory and the benefits of either, but for us that this is a voluntary program, we're really excited that people are really buying into this, and so we really help them look at a way to continually improve the quality of their center. So we're excited about the startup. We feel like it aligns well with the federal government and all the national movement. Like I said, our funding comes from the Office of Child Care, and their goals is really to improve the health and safety of centers. That's our kind of goal from them. And so, when they ask us, well, why would we support centers?